Hello and welcome back to my channel. Today we're talking about a condition that can cause excruciating facial pain, trigeminal neuralgia. This is a chronic pain disorder that affects the trigeminal nerve, one of the main nerves in the face. The pain associated with trigeminal neuralgia is often described as sudden, severe, and stabbing, making even simple daily activities unbearable. Understanding this condition, recognizing the symptoms, and exploring the available treatments can help patients manage their pain and improve their quality of life. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. The trigeminal nerve is responsible for carrying sensory information from the face to the brain. It has three major branches that control sensation in different parts of the face, including the forehead, cheeks, and lower jaw. When this nerve is affected by trigeminal neuralgia, even minor stimulation such as brushing the teeth, talking, or feeling a breeze on the face can trigger intense pain. The pain can be unpredictable and may occur in short bursts or last for longer periods. Trigeminal neuralgia is known for its sudden and intense pain episodes, which can feel like an electric shock or sharp stabbing sensation. These episodes usually last from a few seconds to a couple of minutes, but they can occur repeatedly over the course of a day. Some people experience pain that lasts for days or even weeks, with intermittent relief between attacks. Over time, these episodes may become more frequent and severe. The pain typically affects one side of the face, but in rare cases, both sides may be involved. The location of the pain depends on which branch of the trigeminal nerve is affected. If the upper branch is involved, pain may be felt on the forehead and around the eyes. If the middle branch is affected, pain may occur in the cheeks and upper jaw. When the lower branch is involved, pain may be concentrated in the lower jaw and chin. Common triggers of trigeminal neuralgia pain include routine activities such as eating, drinking, talking, brushing teeth, shaving, or even touching the face lightly. Cold air, wind, and sudden facial movements can also set off an attack. While some people may have warning signs before an episode, such as a tingling sensation, others experience the pain suddenly without any prior symptoms. Over time, as the condition progresses, pain episodes may become more severe and occur more frequently. In some cases, people develop a constant aching or burning sensation between attacks. This is called atypical trigeminal neuralgia, and it can be even more difficult to manage than the classic form, which consists of sharp, intermittent pain. Trigeminal neuralgia is usually caused by compression of the trigeminal nerve by a blood vessel near the brainstem. This pressure damages the protective covering of the nerve, called the myelin sheath, leading to abnormal nerve signaling and intense pain. While vascular compression is the most common cause, other potential triggers include multiple sclerosis, which can lead to nerve damage, or a tumor pressing on the nerve. In rare cases, injury to the trigeminal nerve from facial trauma or dental procedures may contribute to the condition. Age is a significant risk factor for trigeminal neuralgia, as the condition is most commonly diagnosed in people over the age of 50. However, it can occur at any age, including younger adults, especially if they have underlying neurological conditions. Women are more frequently affected than men, though the reason for this difference is not entirely understood. Diagnosing trigeminal neuralgia involves a thorough medical history and a detailed description of the pain. Because there is no specific test to confirm the condition, doctors rely on a combination of clinical evaluation and imaging studies to rule out other causes of facial pain. The key features that distinguish trigeminal neuralgia from other types of facial pain include the sudden onset, the electric shock-like quality of the pain, and the presence of triggers that set off an attack. A neurological exam is often performed to assess facial sensation and nerve function. If a doctor suspects trigeminal neuralgia, an MRI scan may be ordered to check for possible structural causes, such as a blood vessel pressing on the nerve, multiple sclerosis, or a tumor. Sometimes an MRI with a special contrast agent is used to get a more detailed view of the nerves and blood vessels. Trigeminal neuralgia can sometimes be confused with other conditions, such as dental issues, temporomandibular joint or TMJ disorders, or migraines. This makes having a thorough evaluation important in making an accurate diagnosis. Managing trigeminal neuralgia can be challenging, but several treatment options are available to help control the pain and improve quality of life. The first-line treatment for trigeminal neuralgia is usually medication, followed by interventional procedures or surgery if medications are not effective. The most commonly used medications are anticonvulsants, which help stabilize nerve activity and prevent the abnormal firing of pain signals. Carbamazepine is the most frequently prescribed drug for trigeminal neuralgia and is often effective in reducing pain. However, it can cause side effects such as dizziness, drowsiness, and nausea. Other anticonvulsants, such as oxcarbazepine, gabapentin, or lamotrigine, may be used if carbamazepine is not well tolerated or loses effectiveness over time. Muscle relaxants, such as baclofen, may be added to anticonvulsant therapy for better pain control. In some cases, antidepressant medications that affect nerve pain, such as amitriptyline or nortriptyline, may be prescribed. Because trigeminal neuralgia pain can be resistant to standard painkillers like ibuprofen or acetaminophen, these are generally not effective in managing symptoms. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, if medications do not provide adequate relief or cause intolerable side effects, interventional procedures may be considered. One minimally invasive option is a nerve block, in which an anesthetic is injected around the trigeminal nerve to temporarily relieve pain. This can be helpful for short-term pain control, but it's not a permanent solution. For longer-lasting relief, several surgical procedures can be performed to reduce nerve compression or disrupt pain signals. Microvascular decompression is a surgical procedure that involves repositioning or removing the blood vessel pressing on the trigeminal nerve. This procedure has a high success rate and can provide long-term relief, but carries risks such as hearing loss, facial numbness, or complications from anesthesia. Another option is a procedure called radiofrequency ablation, in which heat is used to damage the nerve fibers responsible for transmitting pain. This can provide significant pain relief, but the effect may wear off over time, requiring repeat procedures. Stereotactic radiosurgery, also known as gamma knife surgery, is a non-invasive treatment that uses focused radiation to target the trigeminal nerve and reduce pain. While it has fewer risks than traditional surgery, pain relief may take several weeks to develop, and some patients experience facial numbness afterwards. In addition to medical and surgical treatments, lifestyle modifications and complementary therapies may help some individuals manage their symptoms. Avoiding known triggers, practicing relaxation techniques, and using stress reduction methods such as meditation or acupuncture may provide some benefit. While these approaches may not eliminate pain entirely, they can help improve coping strategies and enhance overall well-being. Trigeminal neuralgia is a debilitating condition that can significantly impact a person's daily life, but with the right diagnosis and treatment plan, pain can often be managed effectively. Understanding the symptoms, seeking an accurate diagnosis, and exploring treatment options can help individuals regain control over their lives. Whether through medications, interventional procedures, or surgery, there are multiple ways to address this condition and find relief. If you or someone you know is struggling with symptoms of trigeminal neuralgia, it's important to consult a healthcare provider to get an accurate diagnosis and effective treatment. Thank you for watching. As always, take care of yourself and make the most of your day.